Commissioner Colleen, Commissioner Garza, Commissioner Clark-Holman, Commissioner Kenizic, Chair Dobb,
Here.
you have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approval of the January 24th, 2024 meeting minutes.
Been moved by Commissioner Colleen, supported by Commissioner Kenizic. Is there any discussion on the meeting minutes? Hearing none, please vote.
Motion carried.
Okay, next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, forwarding a final copy of the Office of Legislative Auditor General's preliminary survey summary report on the Controls Over Family Medical Leave Act, Department of Personnel, Human Resources.
Thank you. I'll turn it over to our Auditor General.
And we have representatives from the Department of Personnel and Human Resources. They could join us.
Good morning.
Welcome. Just make sure your microphone's on the green light. And before you speak, if you can introduce yourself, name and title for the record.
I'm Shirley Priscorn, the Disability Administrator under PHR under Donna.
Dorian Hoskins, Disability Manager for PHR Disability Administration.
Beatrice Golden, Department Administrator under PHR under Admin.
Donna Wilson, PHR Director.
Thank you.
And Marcy Cora, Auditor General, and I'll have staff introduce themselves.
John Kellett, Audit Manager.
Andrew Ray, Principal Senior Auditor.
This engagement in front of you, the Controls Over the Family Medical Leave Act, as a result, it was on our audit plan as a result of the amount of Family Medical Leave Act and the overtime when they use the intermittent leave. So we included this on our audit plan. This is a little different than, this is not an audit report. We did not complete the audit. And when I go through the PowerPoint presentation, it'll explain why. But this is something that the State of Michigan Auditor General's Office uses when they do their preliminary surveys and they determine there's not enough risk to continue the audit. So this is a mechanism we'll be using in our office. The objective of the engagement was to evaluate the internal controls over granting and tracking of the family medical leave in compliance with laws and regulations. Just a little background on the methodology we used. We reviewed all the documentation related to family medical leave. We performed walkthroughs at the administrative departments along with the Department of DPS and the Sheriff's Office. And then we analyzed the utilization of the Family Medical Leave Act. It takes us to page 5 in the PowerPoint. Just a little background. And then I'm sure the administrators can provide more information if you have other questions. The Family Medical Leave Act allows eligible county employees to take job-protected unpaid leave or to substitute appropriate paid leave for up to 12 weeks per 12-month rolling period for the incapacity due to pregnancy, prenatal medical care or childbirth, care for an employee's child after birth replacement with adoption or foster care, care for an employee's spouse, child, or parent with a serious health condition, and then the serious health condition of employee. I'll have this. For our period of review was October 1st, 2020 through the pay period ending March 5th, 2023. The gross payroll for that period of time was $520.9 million. Of that $520 million, 5.6 was related to family medical leave. Then we broke it down based on our analysis. The sheriff offices was contributed $2.95 million. And DPS was the next department with $700,000 of family medical leave related. We designed our preliminary survey today to obtain an understanding of the program and identify areas for improvement in or deficiencies. But based on our preliminary survey, we didn't identify any significant concerns that would warrant additional use of our audit resources. And I'll give a little information on the factors that impacted our audit determination. The Family Medical Leave Act processes appear to be in compliance with regulations. There's sufficient reviews to determine employee eligibility. Queries are conducted to ensure the applicant has worked the 1,250 hours in the preceding 12 months. Queries are done to ensure the applicant has not exceeded the 480 hours of family medical leave usage in a preceding 12-month period. At DPS, managers and timekeepers are communicating observed time card discrepancies with participants. PHR and M&B and the sheriff's office appear to have safeguards in place to prevent the improper recording of leave. However, we did notice some observations that we think could help in the future. Employee time cards are completed and submitted to a timekeeper who review and then enter the time. It's all pretty much a manual process. There could be discrepancies based on the family medical leave entry, but we believe once the Connect 43 is up in place with the electronic submission of leave, and it'll go to the supervisor and the timekeepers, it should prevent any misuse of the recording of time. So we think that'd be a great feature once Connect 43, as long as those features are in place. Something else we observed during our walkthrough is that at the sheriff's office, they're utilizing DocuSign for the paperless exchange of FMLA paperwork. And we think that would be something that the county may want to consider in the future for all county departments, which would help with the efficient flow of documentation. And this is really quick. I just wanted to thank all the representatives here. We spent a lot of time with them, working with them. They do a great job. And I just want to thank them for all their support they provided to us. And if you have any additional questions, they're here.
I'm glad that, we have no issues with this, and we're not going to have to continue the audit. And I know it's not in the PowerPoint here, but in our analysis, there was that pie chart showing the departments that use the FMLA. The sheriff's department, use the most. So it's good to see that they are using the DocuSign process for the paperless exchange, and that when we move to the Connect 43, that will be even more improved. I have a question for Ms. Wilson. When employees use the FMLA, do they have to provide some sort of proof or documentation of like a childbirth or medical issue, and what's required for them?
Yes, medical certification is required for the illness and any qualifying condition under the FMLA in accordance with the statute.
Okay, and so they submit that to their supervisor?
No, it is required to be submitted to the disability, and I'm going to try the phrase workability unit.
Okay.
So that's where it's required to be submitted. Employees may elect to provide it to their supervisor, but we try to discourage having medical information provided to the local supervisor.
Okay, all right, great. And so that's to protect their privacy.
Yes.
Okay, all right, wonderful.
And I
Marcy?
could just,
Oh,
Just,
yeah.
and one of the reasons I really asked or encouraged everybody in the unit to be here, because it is a labor-intensive process and they have been very committed to it. And so I just want to thank them. I know you guys have thanked them also. And so ask for you to be here to receive the public accolades also.
Thanks, Donna.
Thank you. Marcy, and then,
I just wanted to add too, that was part of our walkthroughs. We walked through the disabilities division, how the paperwork comes in and everything for the certification. So everything is in order.
definitely. Commissioner Clark Coleman?
Yes, yes. Is there any follow-up on individuals who apply for the FLMA?
Consistent follow-up, and I'll let Dorian, because she works one-on-one with them and their medical providers.
Okay.
Yes. So recertification is due back after 6 months of the approval. And if there's any questions or discrepancy, something we might see, we reach out to the employee for a conversation. There's forms that we fill out. If there's something missing on the initial certification, we give them anywhere between, per the rig, 7 to 15 days to rectify anything that may be missing or insufficient. So there is follow-up.
Okay, so if the person is ill themselves, I can understand. But how do you confirm that when they say my mother or my brother or my spouse Do you ask for, do you get confirmation on that?
So for a qualified family member, there's a different set of certification forms that's required by the Department of Labor. So that qualified family member's physician fills out those forms.
So you do get forms from that person's, the spouse or
Physician.
parents or. So you are able, because I know with the health confidentiality act that you can't get those kinds of questions we can't require them
Correct.
to provide it. So I was just wondering how you're able to confirm that what they say is true, that
Yeah.
these people, that the parents are ill, or without going to that parent's doctor.
Yep, the forms are filled out by that parent or that spouse, by their physician. And we can always write to the physician if we need clarification as well.
Oh, so they will verify to us?
Yes.
The forms, in accordance with the statute, the forms do contain permission to receive that medical information in order to apply the FMLA benefit to the.
Oh, okay. So in order to qualify for it, you have to agree to allow the county
Correct.
to ask for and receive that information from their physician.
Yes.
Okay.
Commissioner Colleen.
Thank you, Madam Chair. My question's for the Auditor General. Madam Auditor, you made reference to it in your opening comments, and it reflected a comment you made in the report itself, saying that the results of the analysis indicates that while significant FMLA is utilized throughout the county, there was no. How do you arrive at the term significant FMLA?
We looked at, and it's something that I think the sheriff's office also reports to, that they have a significant amount of FMLA, which contributes to their overtime. But we looked at the percentage from the gross pay to the amount of FMLA that was utilized. The $5.9 million.
Yeah, but you don't, there's not like an industry standard
No,
or
no.
anything. So when you say significant FMLA,
And that's
that doesn't necessarily mean like we're out of whack with
absolutely not. No,
standards or.
no.
So I was just wondering what that meant then.
And it's more, we believe that the FMLA contributes to a lot of the overtime in the sheriff's office. And I believe the sheriff's office will agree with us.
Yeah.
Especially the intermediate.
Which it does, and we've known that for a long. Clarify that. Thank you, Madam Chair.
Any further questions?
Yeah, one last,
Commissioner.
just to make
Clark?
sure that that I understand this correctly. So when they go on, when they ask for and they're approved for the FLMA, they have to use all of their time first? Do they like vacation or sick time or anything like that?
Surely.
No, they have a choice as long as their contract doesn't, sometimes their CBA will say whether or not they must use their time for any leave of absence, and other contracts give them a choice. So they don't have to, FMLA starts as soon as, the doctor says that, as long as they qualify.
Mhm.
It goes by the dates that the doctor put on the certification. And if the employee chooses to use their paid time, it starts right then.
And if they choose not to?
Then they're unpaid. FMLA is an unpaid leave of absence.
Oh, okay, so they're just, okay. So but they can.
They can, yes.
They can
Yeah.
use like sick time, vacation.
Sick or
and all
vacation.
that.
That's correct.
And when that runs out, then they're on unpaid leave.
That is correct. Unless they are, if it's a full-time leave and it's for the employee, they do have the option of applying for long-term disability if they're going to be off a period of time.
Okay.
I could just add to that point too, and Shirley just referenced it. There's the two types of leave too, and Shirley may want to respond to it. You get the full-time leave where individual is out for a period of time, but then you also have the intermittent where I believe they can take in hour increments.
They actually less than an hour, 10-minute through PeopleSoft.
Wow. Oh,
Yeah,
my
I
God.
mean, some people,
That must be horrendous.
Yeah.
Trying to keep track of that.
Well, that's the timekeeper that does that. But yeah, some people may, it could say that on their leave of absence paperwork because of whatever medication or, different reasons.
Right, and any other questions, Commissioner Colleen?
Just moving to receive and file.
Oh,
forward to the
Oh,
commission, Madam
yeah,
Chair.
that is a motion. Well, it's been moved by Commissioner Colleen and supported by Commissioner Garza. Any last questions? Hearing none, please vote.
Motion carried.
Thank you. Thank you all for joining us.
Thanks.
Madam Clerk, next item.
F, such other matters as may be properly submitted before the committee.
Right, we have one from
I-
our Auditor General.
I had one item. I know we're going to have the prosecutor and person, everybody come back for the fraud investigation policy, but I wanted to report back that we did do a test email to the prosecutor's office using the link that was on their website, and we finally got where they're able to answer. So the link does work.
Okay,
I got
great.
their response last night.
Okay, all right, wonderful.
And thanks to Darcel, we've been working together on Antonio Guerrero.
Okay, perfect.
Okay, good.
Okay, next item.
G, public comments.
Okay, is there anyone here who would like us to make a public comment to the Committee on Audit? Or anyone on Zoom or on the phone? You can just unmute yourself if you're on Zoom. Did we receive any emails?
No emails.
Anyone wishing to make a public comment, please come forward or speak. Last call for public comments. Okay, next item.
Adjournment.
Is there a motion to adjourn? Been moved, supported. Any objections?